My name is Eileen Balahadi. I'm the Executive Director of the White Center Community Development Association, or the CDA for short. One of the areas that the White Center CDA has grown over the last couple years is in the area of health and wellness. It's an issue that many of our families and children, mostly families, are bringing up, that we really need to live in a healthy community, which means living in amongst healthy homes and healthy school and healthy neighborhood. The White Center CDA is part of a partnership. It's funded by the Kellogg Foundation called the King County Food and Fitness Initiative. And we're one of two neighborhoods, White Center and Delridge.
My name is Alice Park, and I'm Program Manager for the King County Food and Fitness Initiative at Washington State University King County Extension. The King County Food and Fitness Initiative is a diverse collaborative working to increase access to healthy eating and active living. And what we want to do is to make the healthy choice the easy and familiar choice. And the project is supported by the W.K. Kellogg Foundation, as well as Public Health Seattle King County and their Communities Putting Prevention to Work program. So we are focusing in two areas, healthy food retail, and then our other focus area is school food and fitness. FEAST is really one of the most successful things around King County Food and Fitness. FEAST stands for the Food Empowerment, Education and Sustainability Team. And what FEAST really is basically youth getting together once a week to kick it in the kitchen. They prepare a delicious and healthy meal together, and then they all sit down together family style to talk about food and community. And what FEAST really does is it helps kids to recognize the power that they have and to actually start to use their power to advocate for change, for instance, in changing or asking for better school food. What I'm looking forward to most are actually seeing these school wellness committees get up and started, so we'll be able to help the schools start up these committees, as well as helping them to do an assessment to really figure out what are the areas to work on. And as part of that, we want to make sure that parents are able to be engaged and to be able to actively participate on these committees and to really have the tools that they need to be able to advocate for changes that they want to see made at the schools and to promote health and learning for their kids. So as part of that, we'll have a series of trainings that are upcoming for parents to then really be able to engage with schools and with administrators, and I'm really looking forward to that.
One of our projects we've been working on is around healthy retail establishment. Interestingly, White Center actually has a number of small produce markets in the community already. So these are small business entrepreneurs, a lot of immigrant-owned, really unique kind of markets. This Fresh Marketplace initiative, also we worked really closely with the City of Seattle, with folks at King County, as well as with the White Center Food Bank. It was really great to have them involved because they were able to raise money to actually offer similar coupons to the food bank clients to also be able to shop in these produce markets. One of my favorite things that we did with the produce markets is we actually tied it to the work we do in elementary schools. It's a great model. We hosted a couple of these math market nights where kids and their families would come. They would learn about math. They would learn about, you know, how to read a recipe and figure out servings. They would look at things like calorie counts and how much fat is in certain things. So it's sort of math infused with sort of nutrition principles. And then at the end of the day, they would actually, sort of like a passport, they'd fill out how many things that they went through. And upon completion, the family would get a coupon to then be able to shop and using those coupons and take home produce and fruits with them that day. I'll say also that we work in partnership with the Southwest Health Initiatives group. So there's folks like Neighborhood House, the King County Housing Authority, and the Seattle Housing Authority that are doing similar kind of Be Active Together type projects.
My name is Denise Tung Sharifi. I work at Neighborhood House, and I'm the project director of Be Active Together. Be Active Together is a 5-year grant funded by National Institute of Health. Its main goal is to address health disparities and to address the barriers so that people in the community have more access to physical fitness opportunities. And the other two theme projects that we work on is to promote community building and building community leadership.
My name is Jen Calleja, and I'm the program coordinator at Be Active Together at Neighborhood House. We have a resident, her name is Spomenka Novakovic. She's from Serbia, and she was very shy. She started participating in our community action team, And then she started volunteering at the food bank, and she's one of our strongest leaders in the community right now. Like, she's one of the ones who has spoken to legislators in Olympia. Just see her everywhere. She's brought a lot of her friends to our exercise classes. She's come to about 110 exercise classes.
We start with community building because it's important for the community residents to feel safe and connected with each other. And when they do, and they feel like they are in the community, where our hope is that they will come out and interact more, come to more events, maybe bring the kids out to the playground, feel safe to walk and interact with other communities. So we feel by building the community and also building some community leadership and understanding how systems work and address the barriers and issues, that will lead them into participating in more physical fitness activities and community building activities. I feel this project is important because underlying the physical fitness promotion, the community building, and the capacity building is really addressing health disparities and social inequities.